You're listening to the PT Pintcast, where smart people in healthcare come to make noise. Here's your host, Jimmy McKay.
Thanks, voice guy. Yes, we are live from CSM. I do want to say thanks to one of our sponsors who's helping us support the show. Otherwise, we can't fly here and do things live from CSM. Empower EMR. They're just down there. I mean, I'm referencing a direction on a podcast, which doesn't make any sense. Empower EMR. If your clinic is stuck in an EMR that slows you down, that's a decision that you made. It's a bad decision. Empower gives you speed, clean workflows, and features PTs actually asked for. Better notes, faster documentation, smoother operations, all wrapped in customer support. Doesn't ghost you. That's what you're looking for. Upgrade your clinic's brain with Empower EMR. Visit empoweremr.com or visit their booth whenever they're at a conference. All right, what if insurance ending wasn't the end of care? Pause for dramatic effect, but the beginning of a different model. You see how we're doing this?
I love it.
Our next guest left traditional neuro rehab to build a nonprofit, community-based wellness model, serving thousands each year. Live from Anaheim, this is Melanie Brennan. Melanie, welcome to the show.
Thank you for having me.
How close did I do on the intro?
It was great.
All right, so walk me through this. What angered you? Because there needs to be, without a good anger, or this shouldn't be like this, there's never a good story, and this sounds like the beginning of a good story.
Absolutely, yeah. I worked in outpatient rehab, inpatient and outpatient at the Mayo Clinic in Rochester, Minnesota for many years. And I had to stop seeing people that still needed care.
You could see the runway, and
they would go home. Mayo's a destination center, so a lot of people aren't from the area. They would go home. I would see them back in 6 months to a year, and I would say, "How'd your therapy go?" And they're like, "I didn't get any." Where I was, we didn't do a very good job with our exercise program, and they would lose everything. If they were able to walk when they left, they weren't able to walk when they came back. They gained 20 pounds. They had sores. They were in much worse condition. And even our local people that would keep coming for outpatient, there's that point where you're like, sorry, but insurance probably isn't going to pay for this because we don't really know.
Correct.
And so we'd stop. But they had so much potential, and the research shows they can get better for years.
Right.
And I was frustrated, and I just told my husband I want to do something about it and started practice.
Yeah, but there's a big difference between wanting to do something about it and actually doing the thing, because the world has inertia. The world doesn't want to change, and you need to, if you need something to move an inch, you've got to give it so much energy to move it even that first inch. Yeah. So what'd you do about it?
Well, I think what really sparked me to do it was I had a patient tell me, "You're really good at this. You think outside the box. You make me work harder than a lot of people. You should have a gym. You should start your own." I would come if you had a gym. So I told my husband, I'm motivated to do this. It's a good time in our life. It was a good time. I was just working part-time at the time. And I said, "Can I try starting a private practice?" Which is super scary. And he's like, "Yeah, okay.
Good.
Yeah, let's do it."
So how's yours different?
How is my private practice different?
Yeah, tell me about
it. So I knew that my ideology had to be that insurance was not what drove care, period. And I had to come up with a way to do that.
Right. So that's nice, but you have to figure out how to do it.
I had to. Yeah, I dug in. I just did all the research myself. I couldn't afford an attorney or a business coach or anything. And even back in 2011, there weren't business coaches for PT. Honestly.
We got business coaches falling off trees now.
Yeah, it was such a different time. I actually had to get books at the library. Like, there was nothing online.
Kids, a library is a building where the Google files live. Okay.
That was a long time ago. But yeah, I researched it, started it. I knew I needed to be a model that was not just PT driven and not just insurance driven. So I hired a trainer to work with me alongside, created a gym atmosphere. So
not a clinic atmosphere.
It was not a clinic atmosphere.
No beige wall, color.
No. In fact, to get started, I actually rented space at the YMCA.
Great. Community already built in.
Yeah, already built in. I used my minivan door to door a lot to get started that first year, but people heard about it. And all of a sudden I had 10, 12 clients, and I was supposed to be working part-time. I had my babies in the car seat with me. I had them playing in the pool alongside me at the YMCA. So I took them with me. But my clients were like, you need your own space. And you probably need some help. And so I hired that first person within my first year. And one of my clients had a strip mall that he owned. And he said,
"Oh,
yeah."
He's like, "Hey, I got a strip mall. You know what you need?
I got an empty space."
Space.
Yeah. So him and I worked together back in 2012. built a gym in a 2,000 square foot strip mall space. From 2012 to 2015, I added 10 employees
Wow.
in that 2,000 square foot space. We had one mat table for 10 employees, which means 10 patients. We had like 4, 5 spinal cord injury patients on a mat, one mat. It was crazy. Yeah. And so, yeah, 2017, we got a 10,000 square foot gym.
That's large.
Purchased it. I purchased it. Wasn't going to rent it. 24 employees later.
What's the name? And when, because people of course, want to Google it next.
Yeah. So originally the name was Exercise Abilities.
Okay.
Came to find that that's really hard to type in a website, really hard for people to spell correctly, really hard for people to say.
Don't go multiple syllables.
It was bad. Great name. People loved it, but so we shortened it. Everybody shortened it. The world shortened it to EA. So it became, hey, I'm going to EA. I thought, hey, that works. So it's EA Therapeutic Health.
Nice.
We rebranded in 2022.
What's the model look like? Someone needs you and they come and you're like, hey, we don't do that thing over there, which is insurance. So how does it work?
Well, funny thing is we do take insurance.
Got it.
For a portion of what we do. So that's been an evolution. We found that a lot of people in our area did not have funds to pay for what it takes to do neuro recovery. Sure. And so I kind of gave in and started taking Medicare and Medicaid and insurances in about 2013, 2014. Found out that you can't pay your staff for neuro recovery with Medicare and Medicaid reimbursement really fast. So in 2015, I converted my practice to a nonprofit. That's kind of where we shifted. And with that, we have really affordable rates for people to continue once insurance, kind of that short standard therapy. So we do both. We charge cash for the extra hour that, they're with us for 2-3 hours.
Right.
So we have a PT see them for whatever PT they can be billable. And then the rest are personal trainers, rec therapists, athletic trainers, that are working side by side with us for that cash-based service.
Sure. PT's in the room.
PT's there. It's PT informed.
Yeah.
Yeah.
Where does advocacy play in sustaining a model like this?
Huge. I'm real good friends with my local Congress.
Should be, right?
Senator.
You should know their name, but even more important, they should see you and know who you are. And here she comes again. She's gonna bug me about this, and that's their job. They have to be bugged.
Absolutely. So I advocate for payment. I advocate for tax laws because we're a nonprofit, but we still have to pay sales tax in the state of Minnesota, which for neuro, you have a $40,000 piece of equipment that you get granted to you. They give you the money, you go buy it. I have to pay taxes on that, which is a real bummer as a nonprofit. So working with them on tax laws, payment, and it's all part of my APTA role. So I'm really busy with working for the association as well.
Good radio segue. What's your role with APTA in Minnesota?
I am the current president.
Congratulations.
Thank you. 6 weeks in.
Why do something like that? And not just for you, but we're sort of in the room where a lot of it is happening, and people see APTA and they might have a pro or a. I always say they're either pro or they might not just be clear of what the value prop is. But why not only be a member? Why also do a lot of extra unpaid work? I don't know if you saw that. It's 6 weeks in. They're not paying you. You know that, right?
No, it's very.
They're paying you in other ways.
1996, when I became a PT student, I joined a profession, and it was never an option for me to not be a part of my professional association because I understood right away because I got involved. I was on the floor at the House of Delegates in Minneapolis, and I think it was 1996 as a student runner.
Yeah.
And I saw it happening. I knew that if we didn't have a voice, our profession could not move forward. And in collective action, I didn't want to be one of those people that weren't active.
Yeah.
Right. Or weren't participating, because with the APTA, we're supporting all PTs and PTAs, every one of them. You look at the new campaign, PT for Future Me. It's advertising physical therapy. It's not just advertising members. Right. It's a collective action movement, and in collective action, there is always going to be people who don't participate.
Yeah.
at whatever level it is. I didn't want to be that.
Yeah.
I wanted to be a piece of our success as a profession, and it's important to me.
What's your BHAG, your big, hairy, audacious goal in your presidency? What's the thing that you're like, hey, if I accomplish this or this or this, that will have been successul in your eyes?
Well, when I sat down with our executive director and said, I'm gonna run for president. I'll do that. I said one thing. I said our focus will be payment.
Yeah.
Then my whole world is revolved around that. Everything comes back to payment, whether we're cash based or insurance based. It's all cash.
It's just whether you're handing it directly or it's someone else is paying it for you.
All payment. And I've been on the board of directors in Minnesota for 6 years, and we do strategic planning. And I just sit there and be like, that problem's because of payment. That problem's because of payment.
Go deeper.
And, unless you're in private practice and you're in like nonprofit where I'm trying to provide services to everyone at the most affordable rate that I can then pay my bills. That's it, right? That's why I'm nonprofit. People say, why did you sell out your business? Because I want to provide service.
No margin, everyone. No margin, no mission.
Yeah, and the payment's just not there. And so I fundraise $400,000 to $1 million every year. I do that too. That's my job currently. Where was I going with that? Payment. Everything's connected to payment.
Yeah.
Everything. And so I just said that's going to be the one thing. I'm probably not going to spend a lot of time reorging. I do this at work all the time, like having to rewrite job descriptions. Probably not going to spend a lot of time on that as a president. I'm going to be working on payments. That's it. So that I was super excited to see the new strategic plan come out that Kyle really promoted. And what's on the top?
Payment. Well, they said it was polled the members, right? Yeah. Always good to listen. Yeah. And they said the number one issue was payment. Mm-hmm. And then there was 4,000 miles of nothing. And then the number two thing. It was payment. Payment. Do that.
Yeah, we have a survey right now that closes tomorrow in Minnesota. What's your top 10 advocacy needs?
Money.
What's at the top?
Right.
Payment. Right. Again.
Payment's going to affect what happens. I mean, there's a lot of you can't shake a stick without hitting 10 new grads or PT students here, or apparently children. It's the first time I've seen just a 9-year-old walking around. Yeah. Maybe there might be a PTA student. I'm not sure. But you can retain staff when they don't leave if you can pay them better.
Payment.
Right?
Everything.
You can afford equipment better. You can open a second facility. Payment.
Everything's payment. It just is. Are
we just waking up to this? Burden? Or are we just deciding that we can actually? What is the deal? Because I've been in PT for 10 years. I have never heard this much movement in that direction before.
There's been an interesting resistance, and all respect. Like I said, I've been for 6 years on the board meeting saying it's all because of payment, and there's an interesting, but we should really have more member engagement. So let's have a 5K. Like, that's not helping us with our primary problem, which is payment. Yeah. So I don't know. We're getting there. I mean, those things are important too. Member engagement's important. Having activities are important. But
do you want to know how you get member engagement? Show them that you're working on payments. Yes, if I come with you, are we going to kick payments ass? Yeah, then I'm riding with you.
This is what I'm saying. This is where our focus needs to be, and this is where it's going to be.
Where's the biggest needle that's able to be moved? State level, national level? Because it's obviously if you can move it at the national level, that's better. It doesn't mean it's easier to do. Yeah. So you're going to answer both because you're a state president, obviously. But I guess the question is where are we most likely to have a touchdown?
We are most likely to have a touchdown at the local level.
Yeah, of course, right?
Yeah. And that's what I know I mentioned it in some recent LinkedIn conversations. But what worries me about the kind of contentious relationship of APTA and with others that aren't APTA supporters, and we are the only ones at the local level supporting the chapters. State chapters are supporting the local changes, which are state legislators. That's the biggest impact on our day-to-day lives is where we work, what state we live in, and the changes at the state level, whether it's legislative, whether it's Medicaid services, which drives a ton, and payment, like Blue Cross Blue Shield of Minnesota, that's local. That we have some issues going on there, and you have to be tackling that local. So if we don't support APTA as a whole, we're not supporting our local chapters. And my worry is that with declining membership, people don't realize how that's going to be impacting them at the state level.
Yeah, weakening things.
Yeah. Medicare is important, yes, but this local advocacy effort, I think if it goes away, people will be like, oh, I guess in Idaho right now, the state legislator has a bill on the floor to stop paying PT, OT, and speech from
Just
the Medicaid. Stop. They're having to fight that.
Yeah.
APTA National provides us a lot of support from the state perspective, but no, it's your local volunteers.
Right.
It's your local chapter. It's your peer that's going to the state capitol and fighting. So what if you went with your peer?
Right.
And we sent, in Idaho, they had all, pick a number, 5,000 registered PTs and PTAs. What if they all showed up at the capitol? Right. But instead they have 30 showing up of active volunteers. So that's where collective action, I think we can do better because we're compassionate PTs and right. PTAs. I think we can do better, and I think we need to show up.
You haven't mentioned other professions, but you think that collaboration across professions is terribly important. Why? And what's the secret sauce there? Yeah.
Collective action, again, needs numbers, power and numbers. We don't work enough with our OT and speech partners. And so that's the first obvious collaboration that each state needs to do better. And there is a movement towards forming more tri-alliances, which I'm working on getting going in Minnesota as a focus. Because again, what if we did combined days on the Hill where their 4,000 OTs and our 5,000 PTs and right. their, 2,000 speech therapists, what if we all showed up together? Because payment is CPT codes. It's not just PT.
Not limited to one of us.
It's not just OT. It's not just speech. So that's the obvious one. And then also I'm seeing in other states, we all need to do better on this, is do we have enough energy to worry about scope creep? Or if we're friends with everyone and we really understood their position of why, right. Whatever that other entity is, why they want to maybe expand their scope a little bit because they're needing to meet a need because there's not enough PTs out there. Right. Maybe they'll listen to us and stop fighting our bills. And we have a lot of that at the state level. We have a lot of fighting from other, keeping our scope under control, but yet, and we don't like it. We don't like it when that profession comes sure. out and says PT shouldn't do that. We're right. like, we're doctors. Yes, we should. But when we show up and say that another profession can't
now we're doing the thing that we just said we didn't.
Yes, and we can get a bad name at the Capitol, and that's not helping our bills go forward either.
Helping nothing go anywhere.
So can we all get along and be friends? I know that there's, there's leverage. There's keeping some eye on others helps us with leverage, helps it's politics. But yeah, I think we can do a better job of supporting all of healthcare because we're all kind of struggling, right?
Sure.
And overlap's going to happen. And sometimes we need it to happen, especially in rural areas. Minnesota has a lot of rural area. There's not enough PTs. There's not enough ATs. There's not enough physicians. There's not enough PAs.
And it's only going to get more difficult, right?
We have a lot of hospitals closing in Minnesota.
We walk around this conference. Everywhere. How many are recruiting? It's recruiting in technology, right?
Yeah.
That's what it is.
Yeah. I have some open positions at my clinic. Put a plug in there. They're hard to fill.
Where in Minnesota?
We're in Rochester, Minnesota. So home of Mayo Clinic. We're a private practice working alongside very successfully a large healthcare system.
What mindset shift do PTs need to better serve underserved communities? I mean, let's say someone wants to eventually open a 20,000 square foot thing. That might be a little bit in the future, but what can they do if someone's listening now?
Yeah. Being open to this idea that not everything comes from insurance. And that's a mind shift that still exists, especially I was just talking to somebody this morning where it works at a large hospital system. And I told them about my model of enhanced programming that doesn't fit the insurance model. So you can do both, right? You can take insurance and you can take cash. Because if you look at the manuals, these enhanced programs, these neuro recovery programs, they don't fit what Medicare pays for. So therefore we can take cash. And she said, but I work for a large system. We're not allowed to take cash. Right? So, or I work with the low income population, so I can't take cash. So this is true. They don't have a lot of funds, but there's things like GoFundMe. If you're open to a nonprofit arm or a nonprofit model, I write grants, and I don't take any state or federal grants. It's all family foundations. It's banks. It's our local Rochester area foundation. They support what we do because they see the difference we're making.
Right. And you're in the community.
And so then something that's $140 an hour becomes $50 an hour, or maybe even $25 an hour. Or maybe they have a GoFundMe that pays full, right? Because I'm able to subsidize the full cost, pay my bills, pay my staff. They get health insurance. But
none of this is on the syllabus in PT school. This is simple, not easy. This is not on the beaten path. That's why you doing an episode on this is so rare, right? It's not that it's nowhere, but it's not everywhere. It's definitely not everywhere.
Very rare. I haven't actually met anyone that has a model like mine. And so, it's very rare, but it's doable and it's possible. It's, you have to have legal support. You have to have accounting support. I mean, I have an accountant. I have an attorney now. I didn't at first, actually. I just...
Yeah, how hard could it be? It's just a bunch of maths. It's just a bunch of numbers. How hard could it be?
I don't recommend it, but I did it. I wrote my own contracts, and I did a lot, at first to get going. But now I would highly recommend legal support. Lots of great consultants out there to help. We are a member of PPS, even as a nonprofit, and I'm definitely the unicorn, and I definitely... Sometimes when I talk
but you can
PPS,
still steal and borrow ideas and spin.
We are a private practice.
Yeah.
We have to pay our bills. We actually have to make extra money for our savings account, right? Nonprofit doesn't mean no
profit, right.
And so I love to share that it's possible. My heart feels happy that I provide so much to the community, and we have our goal is access for everyone.
Good. And the website, one more time, someone wants to take a look.
Oh, it's easy. ChooseEA.org.
Smart. Rochester, Minnesota.
Mm-hmm.
If you like, by the time they get hired, it'd probably be spring. It'd be a little cooler, or a little warmer in Rochester, Minnesota.
It is a beautiful, beautiful year-round state. But you do have to like some snow.
Or curling. Your husband's taking up curling, you mentioned before.
He'd like to. We'll see. The Olympics has sparked some interest.
Melanie, we have a tradition on the show. Every episode we do something called the parting shot.
This is the parting shot. One last mic drop moment. No pressure. Just your legacy on the line.
All right, parting shot brought to you by U.S. Physical Therapy. We're at the booth right now. U.S. Physical Therapy, a national network of clinics focused on developing clinicians, not burning them out. Leadership tracks, mentorship, career growth. Find them online at USPH.com or find them here if you're watching the live stream. I swear this is not pre-recorded. We are at the expo hall at USPH's booth, which is 1244. I'm probably look for the guy in the ridiculous tuxedo that I bought on Amazon. I buy tuxedos on Amazon now. Melanie, parting shot. What do you want to leave as your mic drop moment with the audience today?
I would like to leave that private practice is not just for orthopedics.
Yeah.
That community wellness and neurologic recovery. We need a neuro gym in every town.
Yeah.
And but you might need to be open to a different model. Yeah. So I would encourage looking at nonprofitness as one way to make that happen.
But in the end, you're now able to provide great care for people who desperately need it. And isn't that why most of us showed up?
It is why most of us showed up.
Most of us.
Yeah, we need to also look at take on an ideology that insurance doesn't pay for everything.
Yeah.
And people should continue to get care after 10, 14 visits.
Melanie Brennan, APTA, Minnesota. Good luck in your presidency. We'll check back in before your presidency is over.
Sounds good.